Now to mounting cases over questionable medical care in the Fraser Health Authority, including new video tonight showing the extent that hallway medicine has grown. Our John Hua joins us live from Surrey tonight. John, the BC Nurses Union came out swinging today.
Yeah, that's because Fraser Health actually has a policy against hallway healthcare just in other inpatient units, and the Nurses Union saying the ER should be no exception.
It's a third world country. They couldn't believe it.
When Meredith McClurg pressed record, she had no idea how long it would go. Bed after patient-filled bed, lining the emergency hallways of Surrey Memorial Hospital.
I've seen it bad there before, but nothing like that. When I went around that corner, I couldn't believe how many people were there.
One of those patients, McClurg's husband, rushed to the ER by ambulance, left to be treated in a hallway for 3 days.
I put 4 blankets on him. He had his jacket on, he had his house coat on, and he was still cold. So imagine these sick people, you know. It's just a terrible situation.
Some of the emergency overfull beds were housing admitted patients with nowhere else to go. Not the first time at a Fraser Health hospital.
This is the first time you've probably got some good sleep, right?
Earlier this month, an 86-year-old left in the hallway at Peace Arch for 3 days as well, before being moved to another ward.
So we realize that we've got to work together with our physicians and with our nurses in order to reduce our reliance on hallway beds.
Fraser Health has stopped hallway care in other inpatient units, but the ER halls equipped with oxygen and suction are left to pick up the slack. The BC Nurses Union says that makes little difference.
I don't think any hallway bed is acceptable for a patient in the province of BC.
Warning the place people go to heal may end up doing more harm.
Nurses are unable to wash their hands, or physicians unable to wash their hands, where patients don't have access to a bathroom. That's concerning. So we have issues around infection control.
It's just sad.
Meredith McClurg coming forward asking Fraser Health in the province to finally fix the problem, fearing the day she might experience what's in this footage firsthand.
It's just terrible, and I dread the day I ever have to go in there.
So John, that footage was shot on a weekend. Could that be why the congestion was so great?
Well, Sophie, just to show that this is an everyday occurrence, sources told Global News that as of 7 o'clock this morning, there were 24 patients lining the hallways of the emergency here at Surrey Memorial Hospital. Sophie?
All right, John Hua at Surrey Memorial tonight.
For just about as long as anyone can remember in the Lower Mainland, there have been scenes like this, a shortage of acute care beds and patients lined up in hospital hallways, and it seems to have gotten worse in recent months.
I just took him in my arms and I said, "I'm with you, I'm here," and he took his last breath in my arms, sitting in the wheelchair in the waiting room.
2 days before his 83rd birthday, retired Dr. Rajendra Joneja died in the waiting room of the very hospital where he had worked as a physician for 20 years. And though his widow believes her husband's death was inevitable, she knows firsthand that there is a systemic problem.
We're always told it's all a matter of money. But the point is that this is a community that is lacking dreadfully in medical care.
तो भाई नहीं करना है काट दे फिर भाई
9-year-old Simrat heartbroken, her baby sister never coming home.
I'm feeling frustrated and helpless. I can't do anything for her.
Balraj Gill's 3-year-old daughter Nimrat woke up with a fever around 2 a.m. February 6th. Mom's gut instinct, something wasn't right. So the toddler's parents took her to Abbotsford Regional Hospital.
They checked your daughter and said, give her Tylenol and go home.
Yeah.
Yes.
Yeah, every 4 hours give her Tylenol. She's okay. That was their response.
But Nimrat's condition worsened during the night. She started throwing up at home. Once again, her parents rushed her to hospital at 5 a.m. February 7th. For hours, they say they waited in the ER for x-rays and blood tests.
Her body color was changing and she can't speak like clearly. Her body is fighting with temperature, fever. That was the answer of a doctor.
Moments later, Nimrat died. Global News has obtained one of the doctor's reports, which states, quote, "It appears that Nimrat succumbed to a large left-sided pneumonia and septic shock, with resulting respiratory failure leading to cardiac arrest." Fraser Health has launched an investigation.
The intention of the review is to look at the care that was provided to this child and to determine if in the future we need to change or should do things differently.
unacceptable, says the family.
I don't think it's going to be fair. It should be somebody independent, not under Fraser Health.
Nimrat was always laughing, running, a strong child with no health issues, says her parents. Their warning, if your child's sick, follow your intuition, demand a second opinion. It could mean the difference between life and death.
I can't understand, like, how can it happen to her? It was so surprising because she was not that much sick that anybody can imagine this result.
Ramina Dea, Global News.
Mary Lou Murphy dedicated her life to helping others.
The passion for people is what Mary Lou had. Mary Lou wanted to love and help everyone.
Loved ones say her fatal mistake, trusting Fraser Health to take care of one of their own.
She put her whole life into her job for Fraser Health. For what? Fraser Health to fail her?
The 56-year-old went to Abbotsford Regional Hospital on January 30th, sweating profusely and in considerable pain. After a 5-hour wait, she was given a shot of morphine and sent home.
She had been treated in the community for muscular spasm with the appropriate medications. That was what the discharge diagnosis was from the emergency department.
Grimo says he visited her the next day at home and knew it was something much worse. Murphy died sometime that night.
All they're doing in that hospital is diagnosing off of symptoms without research, without looking in to what's actually going on.
The family of Nimrat Gill sharing similar concerns. The 3-year-old died during a second trip to Abbotsford Hospital after being told to treat a fever at home with Tylenol. A doctor's report shows the child might have died of cardiac arrest, stemming from pneumonia and septic shock.
I can't understand, like, how can it happen?
The two deaths occurring only 1 week apart.
What we're hoping is that these were isolated incidents that happen to be closely linked in time only, and that's why we do a review.
Loved ones say if Fraser Health failed to properly treat Mary Lou Murphy,
just like the other family, I don't think Fraser Health should be investigating.
What faith should they have in the health authority properly diagnosing itself? John Hua, Global News.
Count to 10 with me.
This is the hard part of healing.
7.
But Amanda Ouvrard says 3-year-old Landon's condition could have been much worse had she listened to the emergency room staff at Ridge Meadows Hospital.
I can't imagine the situation that I would be facing right now. I could be planning a funeral for my son.
Landon was lethargic, his temperature spiking at 103. Ouvrard says her family doctor's office said go straight to the ER.
And they said, we don't understand why you're here. You want macaroni.
Ouvrard told it was likely a common cold, treatable at home with Tylenol and Advil. The next morning, their family doctor ordered chest x-rays, prescribed antibiotics. Landon had pneumonia. The circumstances similar in the death of 3-year-old Nimrat Gill, first sent home from Abbotsford Regional Hospital, only to be rushed back in the next morning. Fraser Health has launched a review. Reports suggest Gill succumbed to pneumonia and septic shock leading to cardiac arrest.
They have lost hope in wanting to care for people who actually need help. And I think that has a lot to do with Fraser Health.
The best test we have in emergency medicine is time, and that's why we encourage every patient to come back if they're getting worse.
Critics say this is part of a systemic problem, leaving Fraser Health ERs overcrowded and understaffed.
It is out of control, and that's putting patient care at risk.
The health minister sticking to the premier's line of blaming a bad flu season, but says action is being taken.
I've had 2 conversations with the CEO of Fraser Health over the weekend. We're putting together an action plan.
Ouvrard says the only action that helped her son was trusting her motherly instincts. John Hua, Global News.
War is war and hell is hell.
BC nurses comparing emergency room conditions to scenes from MASH, but comedy has nothing to do with it.
Nurses work on the front line of wars every day.
People who've been inside Abbotsford Regional Hospital's ER say it's frightening.
The screaming was like the fear of death. You could feel it.
Wadi Love in the ER with his mother this week when a child passed out right in front of them. The wait to get him help, he says, was excruciating.
I don't want to bring her back to this ER. You know, I'm scared.
Reviews already been launched into the recent deaths of 2 patients. Families concerned they may have been misdiagnosed before being sent home. A tour by the BC Nurses Union now raising concerns the system is broken.
The nurses are consistently stretched. They are stressed. They are working 16-hour shifts. They are working without breaks. They're tripping over people.
The BC Nurses Union says that Fraser Health have to throw both patients and nursing staff here at Abbotsford Hospital a much-needed lifeline. They say in the emergency room there are supposed to be 88 nurses on staff. In reality, the union says that number closer to 56 nurses. And unless something changes, both nursing staff and patients will continue to suffer.
So we have 30 vacancies. We have significantly expanded the specialty training we do.
Critics say the problem isn't recruitment but retention. Bottom line, people don't want to work where they're set up to fail.
You can't provide safe patient care when you're missing a third of your staff.
Global News asked Fraser Health executives if they'd walk through the ER with the nurses union.
I go there on a regular basis. I see what's happening.
When pressed on the value of seeing a nurse's perspective,
I am willing to do that at any time.
The comparison might have been made to television.
The bureaucrats need to get out of their office and go into the trenches.
But the need for something to change, very real. John Hua, Global.
Are you injured? He got me pretty good.
They became nurses to care for others.
Is there a nurse nearby who could help you? I am the nurse.
Only to go home bruised, bloodied, or worse.
I am so scared. I am really so scared.
Verna Batsion, an elder care nurse at Vancouver General Hospital, was trying to keep an aggressive patient from falling down when she felt a sudden pain in her hand.
The pain is really throbbing, excruciating. It's so painful.
It's just one of many violent acts suffered by nurses in British Columbia, a number that's risen 50% since 2006.
Assaulting a nurse or abusing a nurse has become routine.
Over the past decade, the Nurses Union says WorkSafe BC saw 9,231 injury claims due to violence. That's nearly 3 a day.
The health authorities have a responsibility under the WorkSafe Act to provide a safe workplace. And with the escalating level of violence, I say that they're falling down on that.
The health minister responding with this statement: this spring we will release a workforce violence prevention policy framework and have committed $1.5 million to implement key actions in the framework. The union is hoping for 24/7 security staffing and also harsher sentencing under the criminal code.
I selected nursing to care for people, but I don't want to be assaulted.
Whether it's because of an increase in mental health cases or a reduction in resources.
I'm in the ER at the regional hospital. Okay, police are on the way.
Nurses say they can no longer be the punching bags of a broken system. John Hua, Global News.
Jean Donaldson was fast asleep when she woke up with a weak right arm.
I assumed I'd had a stroke. I called the fire department and the ambulance came.
The senior had suffered bleeding in the brain. She was admitted to the ER at Eagle Ridge Hospital. The former neuropsychologist still can't comprehend what happened next.
I was moved from the emergency room proper on a gurney to the lobby. And there were 4 other gurneys there with screens around them. I was there for a total of 36 hours.
36 hours in the lobby next to the gift shop and directly above her head.
This is ironic. I was lying under plaques that list people's lifetime contributions to Eagle Ridge Hospital, and I was lying right under my name. I'm angry at the provincial government. I'm angry that there isn't funding for hospitals.
I want to get back to Jean Donaldson because this is really about people.
The senior's story front and center in the legislature.
Why does this government believe that it is okay for vulnerable seniors to languish in the lobby outside the hospital gift shop while waiting for a hospital bed?
They had the opportunity, would build capacity to 150% to accommodate the busiest days of the year and leave hospitals half empty the rest of the year. Good stewardship of taxpayers' money, Honourable Speaker.
Since Donaldson's incident 5 weeks ago, more beds have opened up to deal with overflow from the ER, says Fraser Health. Donaldson convinced it's a much bigger problem.
I'm not on Christy Clark's radar. I don't think she cares about people like me. I'm not sure she cares about this situation.
Ramina Dea, Global News.